bachelor's degree in psychology at the Citadel, a master's in community counseling at Georgia State, and a master's and doctorate in clinical psychology from the Georgia School of Professional Psychology. He sees the entire age range of clients and works with nearly all issues or diagnoses. He's married and has 2 adult daughters. I've had the privilege of hearing Dr. Dubose speak several times and believe that he's gifted at taking his great depth of knowledge and teaching simple and practical steps. So help me welcome Dr. Dubose.
Hello. Y'all hear me? Yeah. All right. I appreciate that, Susan. I first met Susan when we moved here. She was a senior in high school. Some of y'all might have known her that long, some of y'all might have known her longer. I'm going to be speaking about ADHD. I know all of you know something about ADHD. Some of you know way more, maybe even than myself. But I'm going to present information with an assumption that you don't know anything, so I don't miss anything. I'm always a little paranoid that I'm going to insult someone by saying something so elementary. And so if you feel that way, I'm sorry, it's not my intent. But I want to make sure we cover, at least the basics. So ADHD, has been recognized under different names over the past century. Hyperactive child syndrome, hyperkinetic reaction of childhood, minimal brain dysfunction, and then in the last iteration before now, attention deficit disorder with or without hyperactivity. I don't know if y'all run into this, but I run into parents many times who get very adamant that their child has ADD, not ADHD, as if that's a big mark of distinction, but really it's ADHD now. And then we do have a designation, as maybe you're aware, that some people have the hyperactivity impulsivity, some people do not, and some people have that in combination with the other issues. So as you can see on your sheet, it occurs in 3 to 7% of the childhood population, which is a huge number of folks, which I'm sure you're not surprised at that number. And then 2 to 5% of the adult population. So in comparison to other diagnoses that I deal with, it's right up there in terms of the numbers. It's very common as far as psychological conditions go. There's a 3 to 1 boy to girl ratio, which drops to 2 to 1 men to women ratio. 80% of the time when somebody has ADHD, it is because they have inherited it. So that is an extremely high number. That's right up there with the genetic components that has to do with height. So generally speaking, when you're running across a child with ADHD, the most likely reason they have it is because it runs in their family. And I'm sure many of you have experienced when you're dealing with a child that, and you're talking to their parents, one or the other parent is saying, well, their daddy's just like that, or their mom's just like that, or I'm just like that, because they are. There are other sources for ADHD. The most common one probably is maternal drug, alcohol, or cigarette smoking during the pregnancy, which can lead to a number of issues, as I imagine you're aware, but ADHD is certainly one of those. Oxygen deprivation at the time of delivery will also tend to cause ADHD. About half of cases with significantly low birth rate and prematurity will result in ADHD. And just a little weird fact, there are microbleeds in the capillaries, not in the scalp, I believe in the upper portions of the brain. And if those are there, then you see ADHD. If those are not there, you don't see ADHD. But that is not something they screen for. I don't even know how they learn that. There's a chemo medication that they use in childhood leukemia, which will end up causing ADHD in a lot of cases. High lead levels can cause ADHD symptoms. And then a head injury to anybody at any age where there's damage to the frontal lobes, and you're likely to see ADHD type symptoms. And I saw this many, many years ago when I had a client that was referred to me from the Shepherd Center in Atlanta, and they had had a significant motor vehicle accident, had to learn to walk, talk, and all that over again. Came back, met with me. The mom was there also. And I was going through the med list and saw Ritalin. And so I just offhandedly mentioned, oh, I didn't know you had ADHD. And they both got really offended and said, I do not have ADHD. I've never had ADHD. What are you talking about? And I said, well, do you have narcolepsy? And they said, no. I said, well, I don't really use it for anything else. But when I was able to look at the records more thoroughly, that person had significant damage to their frontal lobes from that motor vehicle accident. And that is a standard of treatment to start a stimulant in those cases. Differential diagnosis of ADHD can be very straightforward, but it can be really tricky. Is testing, full psychological evaluations are not usually needed. I prefer not to do them because I feel like it's expensive and time consuming and just not really needed. It's excessive, but it's not bad. It's just usually not required. Usually I feel comfortable in sometimes one session, but certainly 2 or 3, and I'll lock in whether or not ADHD is an issue or not. It is helpful to have information from collateral sources, and I'm sure many of you have gotten requests for various forms in regards to ADHD. You know, like any checklist, they're about as useful as the sincerity of the person filling it out. So I appreciate you doing it. I'm going to come back to some of the overlapping symptoms, but suffice to say that ADHD, in my opinion, gets overdiagnosed in a lot of cases. Unfortunately, I don't mean any disrespect to pediatricians, but you know, they get pressed with a child that's struggling and you know, are pressured to do something, and I feel like in many cases they jump to a conclusion just because of the time constraints and situations they're under. Many do not do that. Many do a very good job of that, but I'm sure you see the results of that. Unfortunately, when we get a misdiagnosis of ADHD, it's hard to pull back from that, has been my experience, is that the medicine starts or whatever treatment start, and even if the person's not doing well with them, we're not typically willing to pull back and reevaluate whether we even have the right diagnosis. It's key going down that path. So I think it's really important to try to get it right and not rush to judgment. There are 3 broad types of effective treatment for ADHD. There's medication, which I could spend the whole time talking about that, but I won't do that. Just know that there are the stimulant medications, and then there's now, I believe, 3 non-stimulant medications that are FDA approved. The stimulant medications are all variations to one degree or another of 3 basic medicines, Ritalin, Adderall, and Dexedrine. And then they have long-acting forms, they have salt tabs, there's patches, there's liquid, there's capsules, there's tablets. They all have a form where they last about 4 hours at the most, and typically those are going to be dosed twice a day or even 3 times a day. And then they all have long-acting forms that go anywhere from 8 hours up to 13 hours. I saw an advertisement for, I don't even remember which medicine, but a newer one that said it went 20 hours, which I don't know the value of that. But then there's the non-stimulant medicines, which are Strattera, which has been around since 2003, and now is in generic form. There's Intuitive, which is just a long-acting form of Wafacin, which was an old blood pressure medicine. And there's a brand new one, which the name is escaping me, but it's similar to Strattera. It's not going to come to me. But anyway, it's just out.
We might give a prize to one of the people that does.
So the stimulant medicines will work. I mean, that is not really a question. If it's a